For thousands of years, many adult women have developed cervical cancer. Cervical cancer was and remains one of the most common cancers in women, and it has, over the centuries, led to a lot of pain, suffering, and death. Almost 40 years ago, a scientist named Harold Zurhausen suggested that cervical cancer might be caused by a germ, a virus called human papillomavirus. Following Dr. Zurhausen's suggestion, Professor Zurhausen and many scientists like him worked to determine if indeed cervical cancer was caused by human papillomavirus. By the 1980s, it looked like Dr. Zurhausen was right. Scientists showed that human papillomavirus, or HPV, does cause cervical cancer. This finding was important because scientists had shown that cervical cancer could be caused by a virus, and if the cervical cancer could be caused by a virus, then maybe a vaccine would prevent the infection and thereby the cancer. Working in laboratories, scientists looked for ways to make a vaccine that would prevent infections with human papillomavirus. Ultimately, the scientists found a vaccine that worked. This vaccine could prevent human papillomavirus and, by so doing, would prevent women from getting cervical cancer. To test whether the vaccine worked and to make sure that it was safe, doctors enlisted the help of thousands of women volunteers. These volunteers allowed doctors to give them the new vaccine to see that it was safe and see if the vaccine protected women against cancer. After years of study, the doctors, working with the women volunteers, found that the vaccine did indeed prevent human papillomavirus infection. They also found that the vaccine was safe and that the only side effect is that it gave some people who received the shot a sore arm for a day. When it was determined that the human papillomavirus vaccine was safe and effective, doctors met to give a recommendation for how the vaccine should be used to save the most lives. The doctors recommended that the vaccine be given to girls at age 11 and 12. 11 and 12 was the right time to choose because girls that age still go to the doctor regularly for things like sports physicals, and because there are other shots recommended at that time too. In 2006, it was decided that the vaccine was ready for widespread use. The manufacturer of the vaccine made millions of doses, and a countrywide campaign was begun to tell people about human papillomavirus, how it causes cancer, and how cancer can be prevented using the human papillomavirus vaccine. Many parents brought their daughters to the doctor so that their daughter could receive the vaccine. Additional research by doctors showed that human papillomavirus also causes cancer in men. Just as vaccination of girls was recommended to prevent human papillomavirus in girls, doctors realized that vaccination of boys could prevent cancer when the boys grew older. Doctors began to recommend that all people, 11 and 12-year-olds, boys and girls, receive the human papillomavirus vaccine to prevent cancer when they became adults. Now that doctors have been recommending human papillomavirus vaccine for several years, we are starting to learn new things. First, we have gathered more information showing that the human papillomavirus vaccine is safe. No new problems have been identified. Second, we have learned that the vaccine works very well and that it can prevent most cases of cancers caused by human papillomavirus in both women and men. Because the vaccine works so well at preventing cancer, more and more doctors are recommending that all their 11 and 12-year-old patients, girls and boys, receive the human papillomavirus vaccine. While some young people state that they don't like getting shots, doctors are quick to remind them that the shot only hurts for a moment, but can prevent greater pain and worry of cancer later. The human papillomavirus vaccine is a great advance in medicine. We can now prevent a terrible cancer with a vaccine. Our new challenge is helping young people and their parents understand the importance of preventing cancer with the human papillomavirus vaccine.